everyone, I'm Dr. AziMD Skincare, a board-certified dermatologist specializing in medical, cosmetic, and surgical dermatology, and founder of AziMD Skincare. Welcome back to my channel. Today, I want to talk about keratosis pilaris. This is also known as chicken skin or strawberry legs. I get a lot of questions about this being on social media. So many people have this condition and they're always asking me what they can do, why they have it, all these tips and tricks that I want to share with you if you have this condition. But before we get started, don't forget to rate, review, and subscribe, and comment below. Let me know what you've tried or if you have any questions. So what is keratosis pilaris? It's also known as KP. We see it in about 50 to 80% of teenagers and 40% of adults. So it is very common and it can have various severities. Well, essentially is when you get bumps, typically on the back of the arms. You can also get them on the front of the thighs as well as in the buttock area. The skin feels very bumpy and very rough. What happens is the keratin that's around the hair follicles, instead of breaking up and dissolving and coming off, they instead form a plug around the hair follicles and then accentuate each follicle, and that's why you see the bumps. And sometimes you can get inflammation with it, which is when you also see redness, and if you're darker skin type, then you can see hyperpigmentation. So who's affected by this? Like I said, it's very common in teenagers. Sometimes it can be hormonal. Sometimes I see it after women have a baby, the pregnancy hormones, as their hormones fluctuate, it can certainly bring it on and make it more severe. It can wax and wane. So a lot of times, like I said, you can outgrow it, but generally people that have conditions like eczema or ichthyosis, which is dry skin, if they have allergies or hay fever, if they have asthma, a lot of times we see keratosis pilaris in that population of patients. It's not that it's caused by any of those conditions, but the two kind of go hand in hand. And then certainly dry climates, extreme temperatures, those can really make it more pronounced. Stress definitely can have an effect on it. It can make it more inflamed and more angry. So what does keratosis pilaris look like? It looks like little bumps, like I said, commonly on the back of the arms, and sometimes you can see the bumps, but you can't really feel them. Sometimes you can feel them and really see them. Some people call it strawberry legs or strawberry skin, and that's because the hair follicles kind of look like little seeds in a strawberry. So what are the symptoms of keratosis pilaris? In general, a lot of times they're asymptomatic. Other than, seeing it on the skin, people don't complain of any symptoms with it, but they can be itchy and uncomfortable, particularly if there's a lot of inflammation there. So it's not just a keratin plug, but there's also an inflammatory component to it. So sometimes the combination of the two can make it more symptomatic, whereas other times a lot of people don't even know it's there other than seeing it on their skin. So how do you treat keratosis pilaris? It can be very difficult to treat because some people's skin just naturally is like that. It's just the nature of their skin for the plugs to hang on to those hair follicles, and that's why it can be very difficult to treat. So the best treatment is really exfoliation, and I prefer glycolic or salicylic acid because what that does is it dissolves the buildup of keratin and cells that form around the hair follicle, and by just exfoliating, it really helps smooth those bumps. Now, if you're using a chemical exfoliant, it can take 2 to 4 weeks to really see results, and you can use things like AHAs or BHAs, which tend to be stronger and more potent. You can also use urea. Urea helps dissolve the keratin that builds up around those follicles. Or you can do an exfoliating scrub. I'm not a big fan of those, but they work well for smoothing out the bumps. Now that's only one component of it, the keratin component. The other component is the inflammatory component, and that's why a lot of times in darker skin patients you can get hyperpigmentation with keratosis pilaris. And if you're fair skin, you can see it kind of looks red. So not only is it bumpy in the texture, but it also looks red. So I like to treat with an exfoliant along with an anti-inflammatory, which is my favorite treatment is really the KP bundle, which uses a spray that's glycolic acid and salicylic acid followed by a cream that reduces the redness and inflammation, I find the combination of both of those products is the most comprehensive and works the best. If you have sensitive skin, then the spray might be too strong. You can also use these clarify pads. They have the same ingredients but not as potent, and it's super easy to just wipe down the back of the arms or the front of the thighs with these pads, and then follow with the soothe, because again, it's the inflammation that gives the redness, the hyperpigmentation. So the combination of the pads or the spray with Soothe HC is a very comprehensive and effective treatment. You can use scrubs. The outset has a exfoliating micro polish that's pretty gentle, so you can scrub that area, but again, you still need that anti-inflammatory component. Amlactin from the drugstore has lactic acid, 12%. That's very effective for keratosis pilaris as well. But be careful, because if your skin is dry, which a lot of times people with dry skin that have KP, when you put exfoliants on the skin, it can really sting. So be sure that you are moisturizing your skin regularly, because that will really help maintain your results. You do have to continue some of these treatments for maintenance purposes, because again, those bumps will want to come back. So once you get your skin from using these products to a condition that looks great and it looks a lot smoother, then you'll want to do some maintenance. And that maintenance can be using the treatments just a few times a week, or using a salicylic acid body lotion, like CeraVe has one that's a smoothing lotion that you would use regularly. So there is some maintenance. And then you also want to avoid extreme climates. So if it's really dry and cold and winter and you got the heaters on, you may want to invest in a humidifier to keep the air nice and moist, because dry climates can certainly flare this up. You also want to keep up with the exfoliation, just because it gets better once you stop the treatment, it might come back. Other products for this condition that work well: CeraVe has a body lotion with salicylic acid. Cetaphil has one that's a triple action acne serum, but you can use it for keratosis pilaris as it has salicylic acid in it. I will list some other products down below in my link for you guys to check out. Don't forget to moisturize regularly, because if you exfoliate dry skin, it will sting. What about keratosis pilaris on the face? It can be really tricky, because the face is so much more sensitive than the body, and a lot of people that have KP on their face tend to also have sensitive skin. So the Cetaphil product, with just 0.5% of salicylic acid, as well as succinic acid, which tends to be anti-inflammatory, and niacinamide with prebiotics, is gentle enough to use on the face. But always do a test spot, because people with keratosis pilaris on the face can have real sensitive skin. It also has a lot of hydrating ingredients like glycerin, which is a humectant, which keeps the skin moisturized. That's probably one of the better ones for KP on the face. Some people ask me, well, what's the difference between folliculitis and keratosis pilaris? Well, the main thing is folliculitis is really inflammation of the hair follicle, the hair root, whereas keratosis pilaris is just merely a buildup of keratin around the pore opening or around the follicle as it comes out of the skin. So even though keratosis pilaris may have an inflammatory component, it's not a deep inflammation in the hair root or in the pore of the follicle. It's really much more superficial. So that's really the difference. But a lot of times we treat them very similarly with exfoliants.
I always get asked about in-office treatments, which work great, especially when you are doing treatments at home. The Diamond Glow helps with texture and hydration. It's best to have multiple sessions. You can do one every 4 weeks. If there's a lot of redness associated with your KP, the V-beam laser works great to reduce the redness and calm the inflammation, as do other treatments like the BBL broadband light.
All right, guys, I hope that was helpful and that gave you a deep dive in treating and maintaining keratosis pilaris, because like I said, it can be a very tough condition, but you're not alone. So many people have this condition, and a lot of times you may see that it gets better with time on its own. It can certainly wax and wane. Thanks for tuning in. Until next time.